Hey folks, Dr. Joe Esposito here. Glad you could be with us. What we're going to talk about today is the adrenal glands. Now, if you've listened to our show before, I've discussed the adrenal glands, sometimes ad nauseum, because they're so important, and nobody seems to talk about them. And without them, our body doesn't function. We can't metabolize fat. Sex drive goes down. Our sex hormones go down. It can shorten your life. So it's such an important, they are two of them. They're such important organs, and nobody seems to worry about them. We talk about the heart and the lungs and the liver and the colon, but the adrenal glands are the control center for all of that. So that's why we got to make sure you understand what the adrenal glands are, what you're doing to mess them up, and then what we need to do to get them working right. So the adrenal glands are two glands. They sit on top of your kidneys, and they're about the size of a walnut. There's two separate areas, actually three areas, but the main one is the adrenal cortex, and that's the outer part of the gland, and that produces hormones that are vital for life. Things like cortisol, which helps regulate metabolism. It keeps your body responding to stress. And aldosterone, which helps control blood pressure. So the outer part is essential. The adrenal medulla, that's the inner part, produces what we call non-essential chemicals. When I say non-essential, you can live without them, but you wouldn't do well. Okay, so you need to get both parts working. So when you think about the adrenal glands, stress oftentimes comes to mind because I've told you that it's a big player in stress. And it's pretty important that you understand that because the adrenal glands are arguably best known for secreting something called adrenaline, which rapidly prepares your body to react to a stressful situation. So right now, wherever you are, if a gunshot went off, your adrenal glands would release adrenaline. Adrenaline would get into the body, open up the blood vessels. It would take blood away from your digestive system, which is at this point non-essential because you're worried about your life. It would pump blood into your muscles so you could run or fight. And so that's what the adrenal glands do. They manage your body's ability to deal with stress. But the adrenal glands contribute to your health even at times when your body isn't under stress. In fact, they release hormones that are so essential that without them, you'd be dead. So the adrenal glands, like I said, they sit on top of your kidneys. They're about the size of a walnut. I was going to go into all the hormones that they produce. Thought that might have been a bit much, so I kind of decided to skip that. It's the fight or flight syndrome. That's something that people talk about. Again, am I going to fight the thing that's attacking me or am I going to run away? So they control the nervous system, and the hormones contribute to this response. So there's epinephrine and norepinephrine. They're the hormones secreted by the adrenal glands, and they're the things that they increase your blood sugar. So again, if the shot goes off behind you, the body's going to release blood sugar into the blood so the sugar can get into the cells, and the cells can utilize the sugar as fuel, and the cells are going to work real well, okay, to do their job. The big problem we have is when we continually stress our bodies. We're going to cover that in a little bit. So many times we're continually stressing our bodies, either chemically, physically, or emotionally. And the adrenal glands are saying, okay, I'm under attack, and it really can't distinguish between chemical, physical, and emotional stress. So if I have someone in my family die, probably the most stressful thing we can experience, according to Dr. Hans Selye, he's a researcher out of Canada, and he says the most stressful thing we experience is death of a loved one. The number two most stressful thing we experience is moving. So you could move to a new house, to a new job, to a new relationship. And so we are creatures of habit. We like things stable. And when things change, our bodies don't respond very well, okay? And, well, they respond. They can respond well, but if it's long term, that's when it causes the damage. So let's assume I have chronic pain. Okay, and as a chiropractor and a pain specialist and board certified in orthopedics and board certified in pain management, we see a lot of pain patients in our offices. And patients come in there in pain, and if the pain is chronic, it's been there for a long time, that puts a major stress on the body. So the body thinks it's under attack and is responding accordingly. Long-term stress like that can essentially burn out, as we say, the adrenal glands. The adrenal glands just can't keep the pace. And so we're going to talk about what to look for in adrenal fatigue and then the things you need to do to fix it. So I want to give you a little hormone terminology. You may have heard these words before and didn't know what they meant. And this is something that always bothers me. If I take a class, and even when I was young, I started playing football when I was in 8th grade. Well, I got out there, and I was a big guy, and they put me right on the line. I was an offensive and defensive tackle, and I was big, and I was strong. No one ever taught me the rules. So I remember one day we were in a game, and I was playing offense, and it was a pass play, and I ran downfield, and I got a penalty. Ineligible receiver receiver downfield. I didn't even know what that meant because no one explained to me the basics. So that's why with these shows and these lectures that I do and the books I write, I try to explain it so that you know what we're talking about, and sometimes you don't even know the question to ask. So you may have heard the term anabolic steroid. These are hormones that stimulate growth, the bodybuilders in the rebuilding process. If I lift a weight, I damage my muscle, and then the body sends in anabolic steroids to rebuild it. And this is the principle that we're using now in anti-aging. Anti-aging medicine, and we have a medical doctor on staff who's an anti-aging specialist, and we'll do things like PRP. So what PRP is, if you have trauma to the body needs to heal. And if you don't have the cells that can do the healing process, the body doesn't heal properly. So trauma sometimes can be good. We can damage an area so that the body sends in new cells to heal. So we can do that with certain therapies. There's something called a TRT, which is a therapy that kind of sends electrical impulses into a joint or a muscle, damages it, then the body sends in what we call stem cells to heal. With PRP, we're taking the growth factor out of your blood, the platelets, concentrating it, and then re-injecting it into a damaged area. So we're sending in cells that facilitate healing from within. So it's your own body cells doing the healing. And that's why we do PRP in our offices, because it's the body's own response. We're not doing drugs, we're not doing surgery, we're doing the body's own response. And for arthritis, especially knee arthritis, shoulder arthritis, muscle damage, tennis elbow, wrist issues, carpal tunnel syndrome, PRP is shown to be stellar in most cases, not all, in most cases to get amazing results without drugs and surgery. So that's why we like to use things like PRP. We use nutrition, we use chiropractic care. So we want to get the body to heal itself and not use external means to get the body to work. So anabolic steroids are hormones that cause the body to grow. Androgens, these are traditionally called like male sex hormones. Now the androgens, men and women both have androgens in their body, and they help with overall health, energy, vitality, growth, development, mood, emotion, cognitive function, immune function, red blood cell development, muscle and bone strength, and protection against degenerative diseases. So these traditional male hormones also produced through the adrenal glands, and so they're really important, but men and women both have them. And if the adrenal glands aren't working, you may not be producing the right amount of hormones for the body to heal. There's also a term you may have heard called bioidentical hormones. Bioidentical hormones are plant-based hormones that are chemically and structurally the same as human hormones. Now, in the case of male and female hormones, a chemist or a pharmacist can compound plant sterols, they're called, from things like wild yam or soy into bioidentical estrogen, progesterone, testosterone, DHEA. And in our office, we can do blood work on you to test your hormone levels. And if you are low in hormones, we can give you a plant-based version of these bioidentical hormones to try to get your hormone levels back to normal again. Sometimes the body just needs a reboot. The body isn't working, there's a short circuit somewhere along the line, and chiropractic care can put the bones back in place. Nutritionally, we can give you certain foods for certain organs. There are certain supplements specifically for the adrenals. We have Dr. Joe's Adrenal Support Supplement. I take it every day. Because again, if you're over 30, if you're over 40, you have stress in your life, chances are the adrenal glands are being stressed. We can nourish them specifically. And so I take Dr. Joe's Adrenal Support as one of my supplements that I take every single day. So we got to get the body right. And if we do a bioidentical hormone, it's a plant-based version that sometimes can jumpstart the organs and get them working properly again. We do that in our offices, and it's really powerful. We can test your hormones. We can try to balance them out, retest, see where we are, do nutrition as well. And that's what makes us different than most other offices. Many other offices might just give you hormones, but they don't give you the nutrition. They don't give you the chiropractic. They don't give you the supplement support to get the body working again. I don't want you taking hormones forever if you don't have to. I want to get it so we can just jumpstart it and get it working naturally on its own. There's something, again, we're talking about hormone therapy, hormone terminology now, so you understand as I talk further what I'm talking about. Cell receptors, these are little places in the cell that they can absorb nutrients or absorb a hormone and then be activated. So a hormone may go to a cell at a cell receptor and activate it. Hormones, of course, these are biological chemicals produced by glands in your body. Very small amounts of hormones we use in a lifetime, but they're so powerful. And that's why even just being a little bit off can cause a major impact on your overall health. And you can upregulate hormone production. What that means is I don't have enough, so my body's going to upregulate and make more. You can also downregulate a hormone. Excuse me. What happens is if I have too much of a hormone, my pituitary gland or one of the glands in my hypothalamus pituitary gland will send a message and say, okay, we have too much of that hormone, stop producing it. So this is what we call a negative feedback system. My body needs thyroid hormones, but my thyroid levels start to go low. My brain produces thyroid-stimulating hormone, goes into the thyroid gland, makes me produce hormones. Then I have enough hormones, it goes back into my brain, and the brain says, okay, we have enough thyroid hormone, stop the production. This is going on all day, every day in your body. When that feedback mechanism goes out of whack, that's when you start to have problems. And so you got to make sure you understand that the hormone system, very little bit is used in the body, but it controls just about everything. Because then the thyroid gland produces thyroid hormones control metabolism, body temperature, hair growth, skin structure. So we have to have all these chemical reactions happening all at once. And it seems like the more we study, the more we find these hormones are controlling everything. And so we mess with the hormones every single day. And I'm going to talk about the things that you're doing every single day to mess with the hormones. There's also, last thing, steroid hormones. These are made from cholesterol. So one of the situations I like to talk about with patients is if you're on a cholesterol medication, it slows down your body's production of cholesterol to lower your cholesterol level. But you need cholesterol to make things like steroid hormones and to make sex hormones and to make cell walls and to make everything work. So we've got to be careful not to just willy-nilly say, I'm going to lower my cholesterol. That's great. What about the function that cholesterol does? You know, cholesterol's good. You need it to live. And so if you have high cholesterol, we've done a great show on it. I don't want to go into cholesterol. I started to go off on a tangent there. Go to our website, drjoe.com, drjoe.com, and type in cholesterol. We did a really good show on cholesterol, and you could listen to that. We talk about highs, lows, what it means. Sometimes you don't have high cholesterol. You're just not recycling the old cholesterol, which then gives you high cholesterol. So you're not producing too much, you're not recycling the old. And then we talk about in that show what to do to kind of clean out the recycling bin to get the cholesterol being recycled. So hormones can be a little tricky, and I don't want to overburden you with too much information here because your brain will explode. But I want to get you to understand that it's not something you want to mess with, and most of us are messing with it every single day. We're doing things, which we'll talk about. We're eating foods that are high in estrogen-like compounds, commercial meats, high in estrogen-like compounds. There's something called endocrine disrupting chemicals or hormones. I was in a grocery store the other day with a family member, and she said, what are parabens and phthalates? And I thought, what a strange question for a teenager. And I said, well, parabens and phthalates are chemicals that act like estrogen, and when they get into the body, they mess with your hormones. And I said, why do you ask? And she said, well, this bottle of soap says no parabens or phthalates. I said, okay, so if you're going to do a soap, that's a better choice. Now, I'd rather you do Castile soap, which is my personal favorite, but this was a commercial soap, and I said, that's a better choice. Because parabens and phthalates, we put them in these soaps and shampoos and conditioners, and they made it creamier, they made it softer, they made it work more effectively. But the problem was it was messing with the hormones. So now, crazy people like me have caused a movement to say you got to get these parabens and phthalates, bisphenol A, get it out of our food supply and out of our chemical supply. And it worked because you're starting to see this on labels now. So now it's bragging rights. People are showing it as a badge of honor. Look, I don't have parabens and phthalates. Good. That's great. Still a lot of chemicals in these things, but the parabens and the phthalates are the ones that get in the body and act like estrogen. Estrogen is a growth hormone. It causes growth. Many cancers are stimulated by too much estrogen. Estrogen in large amounts cause you to lay down fat. Fat, in turn, becomes a living, breathing organ and starts producing estrogen. So estrogen produces fat, fat produces estrogen, and this is why women have a harder time to lose weight than men in most cases, because women are what we call estrogen dominant. They have more estrogen than men. And so if we can take these things out of our lives, these endocrine disrupting chemicals, we're going to take the stress off our hormone system, and the body's going to work more efficiently. So we did a show a while on household chemicals. You might want to listen to that show. We've done shows on male health and female health. In fact, we did 2 shows on female health. Now we have a show on adrenal support. So you might want to listen to these shows if you're concerned about your hormones. And who should be concerned about their hormones? Everybody. So I want to talk about some of the hormones. The big one, the granddaddy of the whole system is called pregnenolone. Pregnenolone is a steroid hormone manufactured in the body, and it's the precursor of other hormones, which means we start with pregnenolone, it becomes DHEA. DHEA, if you're functioning normally, becomes your sex hormones, testosterone, estrogen, progesterone. If you're under stress, pregnenolone becomes DHEA. DHEA then becomes cortisol. And cortisol is the stress hormone. Now, in a perfect world, your cortisol levels are high in the morning, they wake you up. Stress hormone, right? Wakes you up and it drops as the day goes on. That's normal cortisol function. So we can check your adrenal function by testing your cortisol function. We could do that in our offices. And as long as it starts out high and drops low, chances are your adrenals are in pretty good shape. There's other tests too, but that's the big one. If you test your cortisol level and it stays high throughout the day, you're under constant stress. Then you have to sit down with my doctors and say, okay, what is it? Is it chemical stress? Is it physical stress? Is it emotional stress? And then we have to get in there and fix that so that your cortisol goes through its natural cycle. So again, pregnenolone is synthesized from cholesterol. Once again, we need that cholesterol, principally in the adrenal glands, but it's also made in the liver, the skin, the brain, the testicles, the ovaries, the retina of the eyes. So it's not just the adrenal glands that make these things. And that's what's cool about the body, is that the body usually has a backup system. You have 2 lungs, you have 2 kidneys. The only thing I can't figure out, and this is a rhetorical statement, of course, is why we only have 1 heart. I would think that we should have 2 hearts, at least 2, because if one fails, we have a backup, like so many other things in the body. We have left and right side of the brain. So we usually have 2 of everything. We only have 1 heart, though, and that's the thing that kind of fascinates me. So they make steroids. It's a steroid hormone. Steroids are a large family of structurally similar biochemicals that have sex-determining, anti-inflammatory, growth-regulating roles. So pregnenolone is the grand precursor, which most of these steroid hormones are made, including something called DHEA. Again, pregnenolone becomes DHEA. DHEA then becomes testosterone, progesterone, estrogen, or if you're under stress, it becomes cortisol. So pregnenolone, it's important you understand this, has been found to be 100 times more effective for memory enhancement than other steroids or steroid precursors in laboratory mice. So if you've never heard the word pregnenolone, you need to know it. That's why you listen to these shows, to get new information. Pregnenolone appears to be the most potent memory enhancer ever reported. Pregnenolone has been reported not only to make people smarter, but happier and enhance one's ability to perform their job while heightening feelings of well-being. Pregnenolone has also been reported to reduce feelings of stress and also help with fatigue. So once again, we got to go, okay, where's the pregnenolone coming from? Coming from the adrenal glands. I'm going to go through all the things you're doing real soon. If we don't get it in this first segment of the show, we're going to cover it in the second segment about what we need to do when it comes to stress. What you're doing to stress out your adrenal glands, to raise your cortisol levels, to affect your pregnenolone function, which is going to affect all your hormones, including your energy, weight loss, sex drive, sex function, blood vessel, blood pressure. All these things are going to be affected by pregnenolone or lack of pregnenolone. So in the case with the steroid hormone, again, pregnenolone comes DHEA, pregnenolone levels decline with age. Now, we have supplements on our website, drjoe.com. One of them is the male hormone support. The other one's a female hormone support. And what it is, it's DHEA. So the DHEA, pregnenolone becomes DHEA. DHEA then can become your sex hormones. If as your production drops, sometimes we need to supplement. I take the male hormone hormone balancer every single day. Okay, because it's something I want to make sure I have enough DHEA, because DHEA becomes so many different things. And no matter how well you take care of yourself, we're going to get older. The body is going to start to function in different ways. It's not going to produce like it used to. But the cool part is with anti-aging medicine, my doctors and I have ways to kind of beat the clock, so to speak, and help keep you younger. And that's the goal, isn't it? I mean, whoever stays the youngest, longest wins. And we can externally look good. We can have plastic surgery. We can do all sorts of things to look good externally, but we also want to be healthy internally. And that's what we're talking about here with the adrenal glands. So hopefully this isn't getting too overwhelming for you. If it is, and you need to listen to this show again, it's going to be on our website, drjoe.com. And by the way, the supplements I talk about, the hormone regulators, we're going to talk about, of course, the minimum supplements everybody should be taking. Super Green's an essential source. Vitamin D, especially in the winter, vital for immune system. I can't imagine anybody not taking vitamin D. All these supplements are on our website, drjoe.com, and you can pick them up in our offices too. Save shipping. We have offices in Marietta, Duluth, Stockbridge, and West Cobb, and we offer chiropractic care, nutrition evaluations, digestive work, anti-aging, DHEA functioning, again, kidney functioning, PRP, which is rejuvenating, taking your healing cells out of your own body and concentrating and putting them back in. Facials, we can do with PRP, we can actually do a natural facial. Hair growth. Can stimulate hair growth. Now, if you're totally bald, it's not going to be the thing for you. But if you have spots of hair loss, PRP seems to work really well for that as well. Hormone balancing. And on our website, drjoe.com, if you look under services, we have a list of all the services that we offer. And you could look at it. If you have any questions, you could always call us or send us email through the website. More than happy to work with you. So pregnenolone, again, works with the brain. It helps the brain and memory function. So many times as we get older, of course, memory isn't what it used to be. It could be because the adrenal glands aren't producing pregnenolone because you've stressed out your adrenal glands. And I'm going to cover that in just a second on the things that you're doing to stress out your adrenal glands. And most of us are. Chemical, physical, and emotional stress. And that's why with physical stress, chiropractic care is by far the most effective, least expensive treatment for pain. So if you have pain, probably want to come see us. So by age 75, our body produces 60% less pregnenolone than it did from our mid-30s. That's a big drop. For this reason, pregnenolone is one of the biomarkers of aging. We can measure your pregnenolone levels and kind of determine chronologically how old you really are. It's kind of like counting the rings in a tree. If you can measure the pregnenolone at any given point in a person's life, and it's often possible to make an educated guess at their age. Now, my goal would be that we fool everybody. And that's what I want to teach you guys. I want to teach you how to get well and stay well. I want to teach you that there's so many things in healthcare you've never even heard of. PRP, perhaps. PRP for hair growth, for facials. Erectile dysfunction. Even PRP is working now for erectile dysfunction. Women, a juvenile revagination. Revagination of the vagina to get the muscle stronger again. Urinary leaks. So there's so many things that we can do naturally to get you well and keep you well. So if you have a health issue, neck pain, back pain, shoulder pain, headaches, numbness, tingling, you're concerned about aging, hormone issues, digestive issues, acid reflux, my team of doctors and I would love to be your doctors. So we have offices in Marietta, Duluth, Stockbridge, and West Cobb. So if you want to make an appointment, go to our website, drjoe.com, and we can set you up a time. The initial visit for chiropractic used to be $375. Through COVID, we've dropped that price to $149. And that includes an exam, x-rays, consultation with me or one of my other doctors. X-rays, I did say x-rays, right? First treatment, going over the x-rays on the following visit, and doing a nutritional evaluation with you. And that's $149. You're probably going to need more care. In fact, very seldom I've ever met a patient who doesn't need further care. We accept most insurances for further care. And if you've ever been in a car accident, ever, if the car was damaged, you were damaged 100% of the time. So as soon as you know somebody who's been in an accident, get them in here. Every day, patients say, Dr. Joe, I hear you talk about if the car was damaged, you were damaged. My friend was in an accident. I'm begging him to come see us. Have him call me if we need to. You got to get in here, folks. Nothing could be more detrimental to your health than not taking care of it. Again, if you want to make an appointment, drjoe, drjoe.com. I'm Dr. Joe Esposito. We'll be right back. Hey folks, Dr. Joe Esposito here. What we're talking about today is adrenal glands and adrenal support. Now, if you don't know what the adrenal glands are, it's two little glands. They're about the size of a walnut, and they sit on top of your kidneys. And they really are important. And I say this a lot, that people talk about the kidney function and heart disease and liver disease and digestive disease. Who controls all this? The brain controls the adrenal glands. The adrenal glands control a lot of these other functions. So they're really important. And the adrenal glands produce something called pregnenolone, and that's like the granddaddy of all of the hormones. And we said that by the time of your age 75, your body produces about 60% less pregnenolone than it did in your mid-30s. And so we can kind of monitor how old you are by monitoring your pregnenolone levels. But we just want to keep the pregnenolone healthy, and we do that by keeping the adrenal glands healthy. Other hormones decline with age. DHEA. Remember, pregnenolone becomes DHEA. DHEA in a healthy person becomes sex hormones. If the person isn't healthy or under stress, it can become cortisol, and cortisol can cause you to put on weight. And then body produces fat, fat produces estrogen, estrogen causes to lay down fat. And so these hormones are all feeding off each other. So we want to try to keep them as normal as possible for as long as possible. So testosterone drops, progesterone drops, growth hormone drops. These are what we call the biomarkers of aging. And pregnenolone provides the initial raw material for which all these other steroids are made. So some of the other hormones will decline because the pregnenolone is dropping. And the pregnenolone comes from what? The adrenal glands. So while youth-giving hormones are diminishing, loss of quality of life starts to set in. You just get old. We slowly begin to experience physical and mental decline, loss of energy, memory loss, visual impairment, arthritis, cardiovascular, sexual decline. And those are just some of the things that go along with getting old. Supplementing small amounts of these neurohormones may slow the aging process, improve the quality of life, and start to rejuvenate the body. That's why one of the supplements I take is Dr. Joe's Men's Hormone Support, which is DHEA. Again, remember, pregnenolone becomes DHEA. DHEA then becomes your sex hormones. So one of the tricks I use to stay young is supplements. I take supplements every single day. The minimum supplements you should take every day are at least Dr. Joe's Super Greens and Dr. Joe's Essential Source. Vitamin D in the winter. I take adrenal support. I take omega-3 fatty acids for brain function and immune health. I take glutathione to keep my liver healthy and immune health. Probiotics I take every single day. I take the male hormone support. So there's several supplements I take because what I've done is I've formulated a protocol for me. Somebody who has my lifestyle, my age, my activity levels, my brain function, and I want to make sure it's working the best it can. Nitric oxide, I'm going to cover that today if I have time. Nitric oxide helps control the hormone production. Without nitric oxide, the ability to produce a lot of these hormones drops. So I take nitric oxide support every day as well. So once again, we can customize a protocol for you if you want to go into that level, and it's really pretty easy to do. Every one of our patients that comes in, we offer a nutritional protocol as part of their treatment plan. It's no extra charge. We add it right in there. And most patients are really appreciative of that because my doctors will sit down with you and say, this is what you should be eating, this is what you shouldn't be eating, these are the supplements we suggest. Let's do 60 days and let's see what happens. I've never had a patient come back if they really did it for 60 days and say, you know what, I really regret I ever did that. They always say, oh my gosh, this is amazing, I have more energy. And then they say, why didn't I do this sooner? And that's the big question I have for you, the listener, is why are you waiting to get well? If you have neck pain and back pain and shoulder pain or numbness or tingling or headaches, come see us. We can't help everybody, but in most cases we can. And we have very gentle techniques we can use, something called an activator. We can do muscle work. We can do a little more aggressive adjustments, manual adjustments. My 6 doctors are all trained to give whatever treatment that patient needs. And the nice part is you have 6 doctors working on your case. So listen, I might love Dr. Irwin, but I'm going to try Dr. Pam to work on me. I'm going to have Dr. Amy work on me, and Dr. Cattle work on me, Dr. Martini work on me, Dr. Ryan. All the doctors are here to get you well. So you can decide, you can try different doctors, see which ones you like. Whatever style you like is what we want to offer you. We want to get you well and keep you well. So we're talking about adrenal function. The adrenals produce pregnenolone. I don't want to beat a dead horse with pregnenolone, but it's really important. Various studies have found that pregnenolone enhances motivation, the ability to acquire knowledge, to remember things, long-term memory, and a research group of psychologists conducted studies in the 1940s and tested pregnenolone on students and workers for their ability to enhance job performance. They found the students and workers had markedly improved ability to learn and remember difficult tasks. Another reason why I take adrenal support and I take the male hormone. Okay, those are on the website, drjoe.com, because it helps you make you happy, helps you remember things. There's very seldom a day goes by where somebody isn't bombarding me with 10, 15, 20, 30 questions a day. And I got to be able to pull these answers out of my hat. Now, we do live radio shows and live lectures many times, and many times we have an audience that's going to ask questions. And it's very, very rare I get stumped. Now, I'm not smarter than you. Let me make sure I get this clear. I'm not smarter than you. I just take care of my brain so it works better. It's like somebody who takes care of their car. It runs a lot longer, lasts a lot longer, runs more efficiently. I want you to do the same thing, because if you do, chances are you're going to be very, very happy. So we talked about the pregnenolone is produced in the adrenal glands. So if you stress your adrenal glands, it can affect your pregnenolone function along with your sex hormone function, your energy level, your ability to burn fat. What might cause adrenal stress? What do you think might do it? How about this? It can be a long list. Anger, depression, excessive exercise. I had a friend of mine years ago, nice looking girl, and she worked out. She was in great shape, and then she started working out. She'd run like 20 miles a day and then go do yoga. And I just remember I didn't see her for a couple of months, and then I saw her again, and she was just wrinkled up. She looked haggard. This is a woman that worked out too much. So you got to be careful with that too. If you're not getting enough sleep, chronic inflammation, that's oftentimes diet or spinal injuries. Temperature extremes, bad digestive issues, acid reflux, heartburn, burping, gas, bloating. How many people have that? Raise your hands. That's going to affect your adrenal function. Hypoglycemia, getting hungry all the time, starving yourself. Fear, guilt, sleep deprivation, surgery. A lot of times people come to me and say, Dr. Joe, I need surgery. And sometimes you do. What do I do? And I tell them, let's get you on a healthy protocol for several weeks before the surgery and after. Other things that can affect your adrenal function: toxic exposure, chronic illness, nutritional deficiencies, worry and anxiety. Remember, chemical, physical, and emotional stress. Overwork, physical and mental strain, trauma, chronic pain, malabsorption, chronic severe allergies. Many times allergies are due to the stomach not breaking proteins into amino acids. So these big chunks of protein get absorbed into your small intestine, and the immune system attacks them, and that causes the allergic reaction. So many, many times with allergic reactions, it's a digestive issue. Not always, but many cases. Other things, associated symptoms that happen when you have impaired adrenals. Garrett said at the break, there are certain things you could look for to see if you have adrenal issues. One of them is bags under the eyes. Bags under the eyes could be a sign of adrenal fatigue. How about low body temperature, nervousness, mental depression, hypoglycemia, poor memory, osteoporosis, weakness, difficult building muscle. People say, I work out all the time, I can't build muscle. Let's check your adrenal glands. Difficulty gaining weight. A lot of times that's an issue. Inability to concentrate, moments of confusion, feelings of frustration, autoimmune diseases, unexplained hair loss, irritability, apprehension, excessive hunger, indigestion, alternating between diarrhea and constipation, autoimmune diseases. There's more. Lightheadedness, prone to getting infections, allergies, dry skin, food intolerance, heart palpitations, low blood pressure, PMS, headaches, dizziness, insomnia, craving for sweets, not perspiring enough. That can be an issue. Something called postural hypotension. I see this a lot in practice. You're laying down, you're sitting down, you go to stand up, you get a little dizzy. The adrenal glands are not able to pump out enough adrenaline to open up the blood vessels and bring blood up to your head, or contract the blood vessels, bring blood up to your head, and so now you get posture hypotension, low blood pressure. And so that also are signs of adrenal problems. So if you had any of those, or all of them, some of you may have all of them, you might want to consider, gosh, maybe it's my adrenals. And then what do we do about it? We're going to talk about that in a second. All right, so I want to talk a little bit about DHEA. Again, a pregnenolone becomes DHEA, and DHEA functions as what's called an anabolic hormone. It builds things. It can build muscle mass. One of the reasons I take DHEA as a supplement. It's a precursor to testosterone and a precursor to estrogen, so men and women need it. Reverses autoimmune suppression caused by excessive cortisol levels. If the cortisol is high, your body starts attacking itself, an autoimmune condition. So what we want to do is bring down that cortisol level by raising up the DHEA, which becomes the testosterone. Stimulates bone deposition and remodeling to prevent osteoporosis. So many times I see osteoporotic patients, and I say, let's look at your adrenals. Improves cardiovascular status, muscle mass, improves your thyroid gland's ability to convert T4 into T3. Listen to the show on thyroid that we did. It's on the website. But T4 is a hormone that's released by your thyroid. It converts into T3, and T3 is the active form of your thyroid hormone. If you don't have enough DHEA, you may not be converting T4 into T3, so you may have low thyroid function. So we can treat the thyroid till the cows come home. May not be the thyroid, maybe the adrenal glands not producing DHEA properly. Follow that? So it's pituitary adrenal thyroid axis, we call it. And each one feeds off the other ones. And that's a whole weekend workshop I'm going to have to do one day on the thyroid pituitary axis that goes on in there and the adrenals. Reverses unfavorable effects of cortisol. Again, the cortisol causes low energy, fatigue, weight gain, bloating, mood swings. So get the DHEA up. That can help counteract the cortisol. Accelerates recovery from acute stress, exercise, mental strain. Cortisol, well, that's the one that is good for short term, bad for long term. Again, the adrenal glands produce cortisol as well. They metabolize and increase fatty acids in the blood to be used as fuel. But again, too much fat in the blood then gets stored as fat. Prevents loss of sodium in the urine and helps maintain blood volume and blood pressure. Maintains mood and stability. Mobilizes and increases amino acids, which are the building blocks of your body. That's when it's normal. When the cortisol gets too stressed because of what? Chemical, emotional, and physical stress. The adrenal glands get stressed. Cortisol goes up. Increases blood sugar levels. Decreases protein synthesis. Increases protein breakdown. Interferes with skin regeneration and healing. You might start getting wrinkles. You might have weak skin, leathery skin. Could be too much cortisol. Lessens secretory antibody production, and that's part of the immune system suppression that can lead to increased susceptibility to allergies. So it can affect your allergies. So what do we do? What are some of the things that we can do to take care of our adrenal glands? Maintain proper adrenal support is don't eat big meals. Eat smaller meals. Keeps your blood sugar stable. So you eat a big meal, blood sugar goes up, then you crash. Keep the blood sugar stable. Eat within the first hour of waking up. Now, if you have some of the symptoms that we talked about, intermittent fasting for breakfast for you may not be a good idea. I don't do well skipping breakfast. I do much better skipping dinner, okay? But eating breakfast is a good idea because it helps stabilize that blood sugar. If you wake up in the middle of the night, you can't sleep, you might have something called nocturnal hypoglycemia. Nocturnal hypoglycemia means that your blood sugar is too low and your body's waking you up to say, hey, I need something to eat, my blood sugar's crashing. Having a handful of nuts before you go to bed, having a half of avocado before you go to bed, maybe a piece of fruit, that prevents the nocturnal hypoglycemia. And so if you wake up many times 2, 3 o'clock in the morning, you just can't get back to sleep, think about it. Did I go to bed hungry? And if you did, try eating something. Then if you sleep through the night, you might have nocturnal hypoglycemia. Now, we can measure blood sugar throughout the day. This is a simple test. Go to bed hungry, see if you wake up. Go to bed with a snack, see if you wake up. See which one works best for you. So if you eat before you get hungry, that prevents that hypoglycemia. So eating before you crash, these are the things that can keep the adrenal support working properly, and we're talking about that today. Excessive ratio of carbohydrates to protein results in excessive secretion of insulin, which can lead to intervals of hypoglycemia. Once again, you eat sugar, carbohydrates, the body releases insulin. Insulin goes to the cells and acts like a key. It opens up the cell and lets sugar in. If you eat too much sugar, your body produces too much insulin. And then the cells can become resistant to the insulin opening them up because they can't take any more sugar. They say, listen, I can't let you open me up. I'm going to get too much sugar. And then you become insulin resistant. Long-term insulin resistance is called what? Type 2 diabetes. Wow. So I know this is a kind of a pretty in-depth show we're doing here today. So if you have questions, or if you missed something, go to the website, drjoe.com, listen to it again. Here's my trick on learning. You have to hear something 11 times before it's memorized, for most people. Some people are smarter than me. But 11 times. You got to hear a song 11 times. You got to hear Dr. Joe say the 7 deadly sins of nutrition 11 times. So 11 times is the secret. So if there's a show that really is impacting your life, something that's saying, yes, Dr. Joe, this is talking to me, what I want you to do is listen to it 11 times. And in most cases, you're going to go, okay, now I got it. And now you become as learned as I am. I'm giving you all my information. I'm not holding anything back. And then you can say, now I got it. And you can become an expert. A lot of schools and colleges around the country, around the world actually, take our shows and play them in the classroom. I'm a teacher. I'm a adjunct professor in all these other colleges around the world. So you're getting graduate information here. You're getting really good, powerful information that doctors listen to. They listen to postgraduate even as students. So you can get it. You just got to listen to the show over and over again as many times as you'd like, as a matter of fact. It's all on the website, drjoe.com. And guess how much it cost? It's my gift to you. This is information we can't keep secret. We have to give this to the public. So we talked about eating and controlling that blood sugar. So make the most of your meals. No exact dietary balance that applies to all people. So it's critical you understand your own body. And so see how you feel. I always say, listen, do what I say for 60 days. Or even when I tell people to give up alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener. Give it up for 2 weeks, and at the end of 2 weeks, go out and have pizza and meatballs and a couple of beers. See how you feel. If you feel great after that, I was wrong. If you see a reaction and you feel horrible, I was right. I've never been wrong. So you really got to find out what works best for you and how your body responds. Now, got a few more minutes. I want to cover something called nitric oxide and how it affects the hormones. Nitric oxide supports what we call homeostasis, which is balance, normal balance, in the lining of the blood vessels. These cells line the interior surface of the blood vessels and the lymphatic vessels. I won't go into that because we're running out of time. So decreased production of nitric oxide disrupts this homeostasis and increases the risk of several conditions like cardiovascular disease, high blood pressure, blood clotting, inflammation. So nitric oxide is vital, and the hormones have a strong effect on the pathways that stimulate nitric oxide production. Likewise, the presence of nitric oxide plays a role in hormone regulation. So they play off each other. Aging is the loss of hormones. Aging is also the loss of nitric oxide. I take Dr. Joe's nitric oxide support every single day. The bottle says take 4 a day. I do well with 2. Okay, because I eat a good diet, so I've got good nitric oxide production. But as you get older, nitric oxide levels drop, and that affects blood pressure. I've had a lot of patients get on nitric oxide. It opens up their blood vessels, which helps lower the blood pressure. They then go back to their medical provider and say, hey, doc, I've been doing this. Check my blood pressure. Your blood pressure's doing great. Let's see if we can reduce or eliminate your medication. That's not my job. My job is to get you well enough so you don't need the medication. Your medical doctor is the one who decides what you do with that medication. So nitric oxide affects estrogen, testosterone, progesterone, DHEA, insulin, growth hormone, thyroid hormone. So hormone production naturally declines as we get older. And so some of the things we can do, little tricks I do, is I'll take things like nitric oxide to keep my levels where they were when I was younger. Now, as I get older, I'm probably going to need more nitric oxide. I may need more adrenal support. But at this point, I'm holding steady. I check my blood on a regular basis. Everything looks good. Check my vitamin D levels. My vitamin D levels, right where they're supposed to be, 60 nanograms per milliliter. You want to be between 60 and 80. Studies have shown if your vitamin D levels are between 60 and 80, you reduce the risk of getting COVID by 50%. There's an answer, folks. The least expensive insurance policy you'll ever buy is vitamin D. It's on our website, drjoe.com. It's got to be vitamin D3, and I add a K2 to it as well because K2 helps the D3 work more efficiently. So we have the secrets. We have a lot of secrets, and every day, every week, every year, I'm learning more and more secrets, and as soon as I know something, I sit down with Garrett and Joe, and I say, okay, guys, let's do a show on this. This is new information. We got to get this out to the public. And that's why it's so important that you listen to these shows, and you got over 1,500 hours of shows on the website, drjoe.com. So nitric oxide regulates the release of the hypothalamic pituitary axis. Remember we talked about the hypothalamus and the pituitary talk to each other, and then the pituitary gland talks to the thyroid, and the thyroid talks to the adrenals talks to the hypothalamus. Estrogen stimulates the production of nitric oxide. Estrogen declines with age. As a result, 85% of women in the U.S. can have high blood pressure by the time they're 85. 85% of women have high blood pressure. One of the main reasons is the nitric oxide levels are dropping. So we can put you on blood pressure medication, or let's try this as well. Let's try to get the nitric oxide levels up. And that's where we have Dr. Joe's nitric oxide support. Progesterone directly impacts the lining of the cells, and it stimulates the expression of nitric oxide. Testosterone deficiency induces endothelial dysfunction. Endothelia is the lining of the blood vessels. Deficiency can lead to erectile dysfunction, vascular dysfunction. Testosterone has a dual action because it modulates the nitric oxide pathway. So testosterone modulates nitric oxide opens up the blood vessels and allows for normal sex function. Testosterone drops, nitric oxide drops, sex function is affected. Oxytocin, it induces erection and increases nitric oxide as well. And so oxytocin is made in the brain. Oxytocin is the bonding neurotransmitter. When a mother breastfeeds, oxytocin is released and you bond to the child. If you have children, I'm sure you've thought a couple of times, how can I turn this child in? I got to get a refund. I can't raise this child anymore. Everyone, even with pets, you think the same thing. But when oxytocin is released, you bond to that person. When you cuddle, when you hug, when you get romantic with your partner, oxytocin is released. So oxytocin is the bonding neurotransmitters. And that's why it's really important, in my opinion, that couples hold hands. Something as simple as holding hands increases your oxytocin level. Hugging. Now, my team of doctors, we're all chiropractors. We touch people all day, every day, in a good way. And so we're getting a lot of oxytocin release because we're touching the patients. And so not only do I feel my doctors are giving some of the best healthcare available in the world, they're also giving something that many patients may not get anywhere else, human touch. Safe human touch, which can increase oxytocin, which makes you feel good. And then oxytocin can affect nitric oxide, which can affect blood flow, which can affect everything. So when we put together a protocol for our patients, we want to get the nervous system working through chiropractic care. Sometimes we need injections, sometimes we need pain management, sometimes we need PRP, sometimes we need to balance the hormones. We want to get the digestive system working. If you have acid reflux, heartburn, burping, gas, bloating, we want to make sure that we fix that. Many times we can adjust the stomach. The stomach can push up against the diaphragm, and I've trained all my doctors to adjust or pull the stomach down away from the diaphragm. And when you do that, it's amazing. Number one reason we see patients is pain. Number two is digestive issues. Then we do a nutritional workup on the patient. We want to make sure you're getting all the raw materials and the nutrients that your body needs to function the best it possibly can. So if we can get the nervous system working, digestive system working, and your diet straightened out, then if we need medical intervention, if we need pain management, if we need injections, we need drugs, we need hormone balancing, we need PRP, we have that available as well. And so we want to get all the services we can to you as quickly as possible so you can get better as quickly as possible. So our medical doctor is an anti-aging expert. I'm an expert in natural health care. All my doctors are experts in natural health care. No reason why you shouldn't be getting well. We even have access to machines that you can put on the muscles that cause the muscles to contract. And the one machine we have, it's called Ollie. In a half-hour session, it can cause your abdominal muscles, your butt, your thighs, and or your arms to contract 20,000 times in a half-hour session. You couldn't work out at that level. It's impossible. So these are some of the secrets that the elite athletes use. These are some of the secrets that the Hollywood experts know. Now you know them. There's no more secrets. So if you want to make an appointment, if you have neck pain, back pain, shoulder pain, headaches, numbness, tingling, go to our website, drjoe.com. You can make an appointment right there. We have offices in Marietta, Duluth, Stockbridge, and West Cobb. We're more than happy to see you. The initial visit used to be $375. For the next couple of weeks, we've reduced it to $149. That's an exam, x-rays, consultation, first visit, the second visit going over your x-rays, and a nutritional workup. All that's available. You can make an appointment, drjoe.com. We have our medical division as well. You can check with our offices to find out what your concerns are medically. We can give you costs on that. We accept most insurances. And if you've ever been in a car accident, if the car was damaged, you were damaged. Please, I'm on my knees begging you, if you're in an accident, come see us immediately. So again, the website is there to order supplements. Send us questions through the website if you have them. Make sure you follow us on Facebook and Instagram. It's very important, at Dr. Joe Esposito. The website again, drjoe.com. I'm Dr. Joe Esposito. We'll catch you next time.